Hello, I'm Brooke Myatt, and welcome to Health Time TV, your local resource for health and wellness. Today on Health Time TV, Dr. Scott Yorker is joining us from the Wellness Chiropractic Center of Queen Village in South Philadelphia. Chiropractic care is the science, art, and philosophy that the brain and nervous systems control all the functions of the body. Chiropractors today are national and state board certified. Treatments are covered by most major medical insurance companies. Well, thank you for joining us, Dr. Yorker, and I'd love to know, how did you get started in the chiropractic field?
Well, I got started in the chiropractic field from an injury actually to my knee after a motorcycle accident. According to my mom and dad, since I was 4 years old, I always thought I wanted to go into a medical field, more of a surgeon. My father's a surgeon, my stepmother is a family practitioner, my mother's father is a cardiologist.
Sure, all in the family.
Yeah, and so that's what I knew, and I thought I was going to go into the same type of field. However, after a motorcycle accident, I had a problem with my knee that did not respond to the typical treatment protocols that I was aware of, and I found myself in a chiropractic office, actually referred there from my dental hygienist.
Wow, very interesting. So how did that get you to where you are today?
So I went to my first chiropractic office with this knee problem. And when I got to the office and he did his thorough exam with me, looking at the whole body as a whole, he asked me, did anybody look at your low back in reference to your knee? And I said, I don't really know what you mean by that. And he said, well, I'm going to shoot some x-rays in your low back, and we're going to take a look at them together to see if we can see any impingement occurring where the nerves go from the back to the knee. When we looked at the x-rays together, I remember him specifically, I was 19 years old, and I remember him saying, do you see one of those bones on that x-ray that don't look like the others? And my finger went right to L3. And then he moved me over to a chart and he said, tell me where L3 goes. And I just read it and it went right to the knee. And I remember getting kind of like chills. And he was like, I can't really promise you I'm going to help you with your knee, but it's possible that while you've been doing all this rehab for years, that the nerves may have been pinched in the low back, allowing the knee pain to persist and it not heal as fast as it should have. And sure enough, within a few months, the pain was gone. It's been over 20 years at this point.
And now you are here practicing for 15 years.
Yeah, exactly.
What a great story that is.
Yeah. And I'm able to help other people with that kind of problem. You know, when you really understand what it's like to be a patient, they see, you know, a younger doctor from maybe the patient's perspective, go, you don't know what it's like to be 60 or 70 with knee pain. And then I can really empathize and understand, yeah, I do. I didn't walk, I couldn't take one step on this knee for a long time, over a year.
What is a chiropractor?
Chiropractors are doctors that focus primarily on finding problems with the nervous system. The treatment plans are designed as a holistic approach, meaning we look at the whole body as a whole. And it's a drugless, non-surgical approach.
Tell me, when a patient comes into your office, what should they expect from their first visit?
On the first visit, they're going to have some paperwork to fill out, and the paperwork's going to go over their past history of any traumas, any injuries, and talk about what he's going to be doing today. And classically, it's going to be an exam designed around your history and the complaints that you're having. Typically, when I do an exam with a patient, we're going to look at orthopedic tests, neurological tests, muscle strength testing, flexibility, posture, balance, and motion. If there's a problem with any of those, we'll then talk about the different natural approaches that we provide for that particular problem.
So Scott, the youth of today are having more and more back problems. How can we help them and assist them in getting chiropractic care?
As far as the chiropractic care goes, we want to look at the child's behaviors and what they're doing with their posture. Meaning, we do that comprehensive exam like we talked about before, and we can pinpoint the functional problems. Now, what's going on with a child these days is the fact that many of these children today are doing a lot of sitting, playing on video games. I know when I was a child, we were out. We played all different types of sports. Sure. These days, I see parents and the children focusing on one sport that they can excel at, and then they can get dominant patterns from that exercise, meaning dominant muscles that are used more often than the others, and over time this will pull the body into a poor posture. It can cause all kinds of neurological impingement, which can show up later in life. Other reasons is our youth of today, their nutrition isn't as good as it should be. A lot of sugar, a lot of carbohydrates, and a lack of exercise.
Yes.
And many of them are overweight. Diabetes in children is in an epidemic level. Yeah. And of course, if we're overweight, the belly pulls the back forward, the center of gravity changes, and that can start to cause problems in the posture in the low back.
We'll be right back with more from Dr. Scott Yorker on Health Time TV. So we were just talking about youth. They're overweight, they're sitting, they're doing video games, they're not as active. And also what's happening is adults are now working 8, 9, 10 hours a day, and we're all sitting at computer desks. We all have bad posture. So tell us, what can chiropractic care do, and how do you analyze if somebody's having those back problems? What should we do?
Adults, like children, are also sitting a long time. 8 to 9 hours a day, if you think about it, is a third of the day.
It's a long time.
Yeah, and if you're doing that day after day, week after week, over time, it's going to cause poor posture. Certain muscles are going to be more, other muscles are going to be ignored. And so there's exercises that should be done on a regular basis in order to counter the sitting posture. Also, when setting up the cubicle or the desk or however your setup is when you're doing your computer work or your desk work, it needs to be optimized for joint health.
And now Dr. Yorker is going to show us his rule of 90s and how to stay fit while you sit.
The way to set this up is what we call the rule of 90s, meaning 90 degrees. We'll start with the ankle and take note that the ankle is at a 90-degree angle. The knee is also at a 90-degree angle, and my hips are at a 90-degree angle. That's how you pick the proper seat height for you. When setting the height of your monitor, be aware that it should be straight ahead of you, and you're allowed a 15-degree down or 15-degree up. Changing it is ideal if you have the ability and the equipment to do so. First exercises are going to be for the neck. Laura's going to place her hand on the bottom of the chair and her other hand just above her ear and side bend her neck to a 45-degree angle. Next, Laura's going to place her hands on the back of her head and look down at the floor and up at the ceiling. Next, Laura is going to place her hands on the front of her forehead, looking up at the ceiling and holding for the same 3-breath count. Next, place your hand on your cheekbone and rotate your head to one side and then the other side. Take a regular rubber band, hold it with both hands with your fists side by side, and then have your hands at chest height. When you're looking at your posture, make sure that both your right and left shoulders look balanced, and then you're going to squeeze your shoulder blades together. And we'll do this for a series of 5 to 15. Move your hands into what we call the praying position with the forearms parallel to the ground. Then switch the hand position to fingers downward, forearms still parallel to the ground. Open your hands up real wide. Close them real tight into a fist, and then shake them out.
So once we've optimized our desk, which was great, you just showed us the rule of 90s, we're still not just typing at our desks, but we have our cell phones, now we're texting, we're using our wrists and our hands, and some people still have that tingling numbness in their hands, and they're calling this carpal tunnel. They're saying they have carpal tunnel. Can you tell us what is carpal tunnel syndrome?
Carpal tunnel syndrome is a type of what's called repetitive motion strain, meaning it's exactly like it sounds. If you do something over and over again, you can eventually work certain muscles a lot, others are ignored, and they can eventually push on a nerve. If it happens to push on the median nerve, it'll distribute tingling and numbness into the thumb and the first 2 fingers. That's classic carpal tunnel syndrome. The lower neck has nerves that also go all the way to the thumb and the first 2 fingers.
Wow.
Specifically C6, meaning the 6th nerve that exits the neck. And so if a patient is not improving very quickly, we need to get a consult with a neurologist and an EMG to see if indeed this is carpal tunnel syndrome coming from the wrist, or is it actually coming from the neck, shoulder, elbow, somewhere along the way approaching the wrist.
Dr. Yorker, we are throwing around a lot of medical terminology. We have carpal tunnel syndrome, and a lot of people hear the word sciatica. Could you tell us what sciatica is?
Sciatica is a distribution of knife-stabbing pain. Literally, that's how it's described, meaning debilitating. It might stop you in your tracks. Numbness or tingling down the back of the leg. The sciatic nerve originates in the low back. And so chiropractors will typically look at the low back, hip, and knee, and ankle, and foot to see if the balance below the sciatic nerve is there, and to see if there's also any impingement above it where it exits the lumbar spine and sacral spine.
How do we treat sciatica?
Chiropractors do a fabulous job with sciatica. I've been practicing in the area for 15 years and I see it pretty much every day. And the protocols are designed around what we found in the exam. For instance, if there are muscle problems, well, we have to work on the muscle, exercising, stretching. If it's a problem with the actual vertebra in the low back where these nerves exit, well, that's where the chiropractor will figure out which one is not moving properly and design treatment protocols that are all natural to get that motion back.
Sure.
And we also want to make sure that the foundation, meaning the feet and the knees, have proper balance, center of gravity, and strength. And then once all this has been optimized, so many times the patient comes in and goes, "That was magical. No drugs this time. I was able to walk into this office and say, I'm finally feeling better."
A lot of people think back pain, I have to go to my chiropractor, but for a lot of people, they don't know that you work on a lot of other parts of the body than just the back. So tell us about that.
Yeah, absolutely. I mean, chiropractic actually means in Latin, chiro means hand, so it means to practice by hand. Originally, it was all done with the spine, but now the states have allowed chiropractors to really work on all the joints of the body. So, for instance, someone comes in with a foot problem, we can just look at the foot and see if we can help them with that. Like I said earlier, a chiropractor is going to still look at it as a total body exam. We're going to see if the nerves that go to the foot are impinged anywhere along the way. We're going to see if there's any flexibility issues or strength issues.
How often should someone see a chiropractor?
In my office, we have 3 levels of care. The first level is relief care. The second is what we call corrective care, and then some will move into what we call wellness care. Meaning, when someone has a problem, they need relief. They come into the office, and we do treatment that's very rigorous, sometimes daily, sometimes every other day. Once we've achieved a certain amount of improvement, we'll then start to develop exercises for them to do at home. They'll start seeing me less, and we moved into what we call the corrective phase. Meaning we're going to start weaning away from the doctor's office as the patient does more and more on their own.
Sure.
And then once the problems have been fixed or maximized to their maximum medical improvement, we then can develop a wellness program. And wellness programs are typically once a month if you're real active, once a year if you're a child, and they are developed around your comfort zone.
When a patient comes to see you and they need maybe a surgeon or a therapist or rehabilitative care somewhere else, how do you work with other doctors and care for that patient?
Yeah, that's a great question. Chiropractors work with other doctors. They're able to refer for x-rays and MRIs and blood work. I think ultimately it's very important that, from my standpoint, being a chiropractor that also does physical therapy exercises with the patients, that they know that there's other treatment protocols out there that I'm not able to do. Chiropractors don't prescribe medication. They don't do surgery. And if the patient feels like they need medication or surgery, or something in the exam says they may need it, it's very important from my perspective to make sure that the patient knows that these other treatments are available. Most are going to want to try the natural stuff first before they cut their body open and have surgery.
Sure.
But also, it's possible that this case is a surgical leveled case that needs to be handled right away. We want to make sure we get them to the appropriate person.
Stay tuned for more Health Time TV. Viewer email is coming up next. Now is time for one of my favorite segments. Is you, the viewer, can write in and send us viewer email. You can do that at questions@healthtimetv.com. And right now, Dr. Yorker is going to answer some of your questions. So Dr. Yorker, we have Cindy from Philadelphia. She wrote in and she says, when I think of going to a chiropractor, I think of sounds of cracking and popping. Why do you do this, and is it safe? So let's talk about Cindy's problem.
That question, Cindy, is a very common one. And in fact, it's probably the #1 reason why people don't go to a chiropractor. When the exam is done for each patient, we decide whether that type of treatment that has the cracking and popping is going to be the appropriate one for that patient. There are other alternatives if the patient is not comfortable with that, or there are signs during their exam that say it's really not warranted and it could be unsafe for certain conditions. And it's very important that we figure that out, obviously, before treatment. And it's very important that you express your concerns to the doctor so you're not worried and anxious about, is he going to do anything that I don't want? And the doctor will usually be real comfortable to explain to you what he can do naturally in a way that's less forceful. And if for some reason he doesn't do that treatment, of course, he's going to refer to another chiropractor that does the other types of treatment.
So Allison in South Philadelphia writes, I'm a runner. Is it true that knees are not made to be run on?
That's a great question, Allison, and I do get that one often. My office is inside of a fitness club, and we have a lot of people there that are on treadmills, on ellipticals, that run outside. And when people are running on their knees, obviously it delivers a little more force than a walk, but the knee needs that. It actually needs that compressive strike as your heel hits the ground, where the knee actually compresses into the cartilage, that's the cushion between the bones, squeezing it as much as you can, and then as you let go, it opens. And that pumping mechanism actually brings nutrition into the joint and actually allows the cartilage to stay healthy and mobile. So for long-term knee health, running is necessary. However, you can't abuse it.
Sure.
So you can't run marathons every day. There is a limit to how much the knee can handle. Also, very important, how's the alignment of the foot and the hip? Meaning we're running on the foot.
Sure.
We're talking about knees, but if we have a center of gravity issue with the foot, or the foot's weak, or there's something that's not right about the posture of the foot, then the knee will be irritated with every single step.
So it's interesting, Debbie's question from the Northeast, she asks, what is the age range of patients? I know we were talking before about the youth of America. She says her mother is 80. Can she see a chiropractor, and is it safe for her mom at the age of 80 to come and get chiropractic care?
If there's nervous interference, then yes, something needs to be done to try to manage that and alleviate that if we can. What's very important, obviously, to be aware of with an elderly person is that their bones are not as strong as a young person. They may have osteoporosis. They may have all kinds of different conditions that might be contraindicated for some of the more intense aggressive adjustments. So like we were talking about with other conditions, the exam is going to tell us what treatment protocol is going to be best and safest and effective. 80 years old, I've taken care of patients that are 97. I've taken care of patients that were 2 days old. So we work on people from literally the beginning.
Infancy all the way up.
All the way up.
Wow. And so this is safe, no matter if you're an infant to age 97.
Absolutely.
Michelle from Mount Laurel, and she's 5 months pregnant, and she's having some lower back pain. She wants to know, is it safe for a pregnant woman to come in and see a chiropractor?
Michelle, I've taken care of many pregnant moms. During pregnancy, as you know, there's certain chemicals that are released in order for the ligaments to become more loose, for the obvious, to be able to deliver a baby through the pelvis. These chemicals don't only go to the pelvis, but they go to the entire body. So at that moment that you're getting closer and closer to delivery, more and more of these chemicals are secreted and the ligaments actually become more loose. At the same time, you're changing your posture because your belly's getting bigger and bigger and bigger and bigger, and it starts to pull you forward. The nerves are in the back part of the lumbar spine, which is the low back, and as your belly gets pulled forward, it can pinch those nerves off. Now, you've probably been instructed that you want to minimize, if not completely avoid, medication while pregnant. And so chiropractic is a great tool to use for moms that are not wanting to take medication. The treatments are safe, effective. We even have tables that the mom can lay on their stomach and the belly falls out.
That's
so
really
that
neat.
it allows them to lay on their stomach, and the moms are like, I haven't laid on my stomach for months. And I've treated moms all the way up to delivery.
Dr. Yorker, one last viewer email, but I love it that these patients can write in. So I would really like it if you guys could write into us. We'd love to hear from you. So questions at Health Time TV. We're going to wrap up now with Joe from Cherry Hill, New Jersey. He wants to know that he always wanted to go to a chiropractor, but he hears that he goes to a chiropractor and it's a never-ending cycle. He can never stop. And I think that's a myth with a lot of people. So what would you tell Joe?
I've been asked that question so many times, and it's a good thing that we're doing this with the viewer mail, because these are the questions that a lot of people have out there in the community, in the world, and it stops them from seeking out a treatment that's safe and effective, non-drug, non-surgical, and it comes from a spot that can make some sense if a doctor of chiropractic never explained it to you.
Sure.
Today is our lucky day. Okay. Basically what we do with chiropractic care is we design a protocol to fix functional problems. As the function improves, we don't need to do it as often. And then your job would be to exercise and change behaviors to try to stabilize that.
So basically the patient has to follow what the doctor says.
It's very important to do that.
Sure.
And if the patient doesn't do the exercises and doesn't change anything about their life, and it happened to come from weak muscles or postural issues or something they're doing at work, then indeed they may need to continue the treatment. Because if they're going to keep causing the problem with something they're doing, they'll need to do something to reverse it. Now, Just like I use an analogy, an example, eating well. If you decided to eat well this week, are you afraid to do it forever?
Yeah.
You know?
Okay.
And so if the chiropractic care is truly working, you may choose to be under care in a long-term basis. We call that wellness care. Relief care, very rigorous, trying to get you out of pain. Corrective care, you start changing your life doing exercises as you wean away from the chiropractor. Wellness care is developed with an understanding that we're trying to now stay well. Classic is once a month with somebody that's real active, but it's really dependent on the doctor's exam and the patient's comfort zone and is it working? And when it comes down to treatment, you really have to try it and see. And there are patients that respond really well to chiropractic care and they don't have to have ongoing forever care.
Thank you so much, Dr. Yorker. Now we just have to get, Joe to come out to the Wellness Chiropractic Center of Queen Village to see you.
Well, Joe, I look forward to seeing you in the office. And remember, whenever you go to me or any other healthcare professional, you want to let them know what your concerns are so that they can help design a program that's really within your comfort zone and can fix the problem.
Thank you for joining us today on Health Time TV. For more local health information and to find a doctor near you, please visit us at healthtimetv.com.